Hello, good morning, good afternoon, good evening. Welcome to the IDS and a panel on on content strategy. When customers are dynamic, why is your content strategy so static? We wanted to broach this topic because historically the pharma industry, and certainly when I was in brand marketing, focused very much on finding, one message and then consistently driving that, mostly through the sales force, but eventually through all channels, and then optimizing reach and frequency. But now that the industry is increasingly differentiating based on customer experience, the leading organizations are really changing their focus on determining is how to organize a customer journey and personalize the content in order to drive their commercial success. So to discuss this important shift, I have a distinguished panel with me here today. Julie Richards, Head of Creative Digital Insight, Commercial Solution Novartis, Amanda Baccarini, VP of Global Marketing Innovation, VP of Global Marketing and Strategic Innovation for Pharmaceutical System of Becton Dickinson, Christina Carlis, the VP of Global Marketing Digital Innovation at Gilead, and Maddie Czarnowski, Content Strategy Manager at GSK. Welcome. Thank you for joining me today. So maybe I'll start the discussion off with a question for Julie. Julie, why is it so difficult for our industry to adopt a focus on content strategy and customer journey?
Well, I think you kind of mentioned it earlier on, Mark. I think, as an industry, we've probably relied historically very heavily on our reps, and they'd often, really curate their content on the fly. Really to personally suit each and every customer that they were meeting with. And now we have multiple channels and multiple digital channels that we need to be able to treat in the same way and be able to kind of have that same impact. So for us, I think as an industry, that means moving a little bit away from a customer journey, which is very focused on what the marketeer needs to kind of validate what they're doing and making sure that they're kind of comfortable with the content they're putting out there, and really shifting more towards that data-driven marketing. So what that means in essence is making sure that the data really tells us what we need to know, that we're following it, that we're building a ton of content, we're looking at how the people interact with that content, and then making sure that we serve up what they want. It's not easy to do, and it's something that we need to work at. We'll get better over time, ultimately get more intelligent, build better content, serve better content out to the customers. But ultimately, what we kind of need to do that is really high volumes of dynamic content that we can access quickly and that we can access easily. The ability to really be able to track what works and be able to relay that back to the overall customer engagement. And then, really kind of helping our marketeers think differently, moving away from that kind of one and done approach we used to have to campaigns, and really looking at it as a kind of an always on kind of content, rather than a regularly driven content kind of a perspective. So ultimately that's what we want to do. It's kind of really kind of finding that balance between what the brand really wants to say and what the customer really wants to hear. And I suppose that's the real mindset change that we need as an industry in order to be able to move towards personalization.
Thank you, Julie. And Amanda, following that, I know you and your company, you're starting on this journey to move away from the static customer engagement to more dynamic journeys. What were some of the first obstacles or the first insights that you had when you started to transform?
I think Julie summarized already, and she touched on some of the obstacles and insights. And yes, I think I'm probably going to learn a lot from my colleagues here, because we haven't really started many years ago, and we are certainly not early adopters. We're more of a medtech company that works with pharma really through a real B2B environment, which makes our life even more challenging to a certain extent, and maybe even personalization to make it a little bit more complicated. Look, the first insight for me when I coming into this role was the realization that our sales and marketing organization did not have enough sufficient deep knowledge of their accounts. Despite the business was successful, we were struggling with positioning new product offering and new innovation. We were, the image that I had was that we were sitting back waiting for recurrent business opportunity to come, instead of really, and very poorly managing, penetrating into new accounts, new opportunity, new customer segments. So I think for me that was critical to drive long and sustainable growth. And the second insight was the customer feedback, either in forms of NPS or sitting with customers, a strategic business meeting. The customer feedback was poor, specifically around communication, transparency, innovation, and what are you doing? What is your company doing around innovation and the future of in our case, drug delivery. So for me, those have been the two indicators that also helped us. They acted as a propeller to change the way we're doing things. So we really didn't have a lot of initial pushback from the organization as to why we had to do a change. I think maybe the obstacles came later, but marketing started this transformation by redefining the customer segments, building a solid customer buying journey, maps, analyzing different key personas. We have applied new sales trainings, solution marketing, solution selling. We deliver those trainings across the organization, and we really sat down with sales and worked with them on building their account plans and their marketing plans, starting ideally using an account-based marketing approach. Selecting a couple of pilots before we went deep. I think that's also inviting some external speakers and some of our pharma partners has helped us to really realize that we had to adapt and we had to do it quickly. So I would say that we didn't find so many obstacles initially, but the pushback or the obstacles came later in terms of difficulty to get the right level of depth of knowledge from sales and regional marketing organization. To be able to really fully understand the content and the material that was delivered, as well as to fully know their accounts and their customer. And also, I would say in terms of pushback, suddenly I think the organization, the supporting functions, the ones that are helping us on producing material and content, they found themselves with a lot of extra work. And that has been challenging at the beginning, right? To really change everyone and work in one direction. So I think that the mindset shift really only happened when we got clarity on accountability. Understanding who owns the account, understanding who owns the different steps of the customer journey, the account plans, who owns the content development, the digital delivery, the funnel management in sales. And I think only understanding that accountability is at the base of driving this mindset shift. This has been honestly the most critical steps we had to take on the organization.
How did you develop that accountability? And again, I asked the panel if you have experience there as well to chime in, but ask the question first to Amanda. But how did you create that? Is it purely top down? Is it more formal?
No, it cannot be. No, I cannot be purely top down. Certainly no. I think on the contrary. I mean, I think that there is a point where, look, I mean, sales, marketing, other functions. I think everyone believes, and they are accountable for one piece of the journey. But when it comes to answering the question, who owns it? Who owns the account? Who owns the journey? I think that's where we struggle to get the answer. So I think it's been a mix of functions, collaboration, and stronger communications between themselves, as well as a little bit of push from the top with meetings, workshop, pilots, different sessions. But I think yes, I mean probably this is a bigger topic, a bigger discussion. But accountability and ownership of the account is probably something that we all I see people now. I think it's probably the biggest issue for all of us.
I know that from an Novartis perspective, you're up hugely change management and kind of driving that kind of accountability is actually one of the biggest things, because I think we've got organizations of really clever people, right? And everybody understands that this needs to happen, and they understand that they need to do this. But we work in a very, because our industry is so regulated, and because we have been working historically in a very different way, it's a huge organizational change to make that happen. And I think in Novartis, we've the added thing of we work in what's called an unboss culture. Some people may understand that term, right? But which is absolutely amazing culture to have. But one of the results of that is a very decentralized organization, right? And, I think to get this right, centralization is key, right? Certainly for an awful lot of elements of it. So that means that the change management is massive, and it's extremely difficult to do. Like, I know for us, we've approached it in kind of multiple different ways. So like we have cross-divisional product organization, and they kind of look after the strategy and the vision and, kind of the roadmap for how we're going to achieve this. We call it next generation engagement, right? But the same thing, right? How do you get to that personalization? And we've also got another unusual thing where we've taken a US first approach, and then we have multiple satellite programs that's working across the other key markets. So that kind of makes everything very difficult to pull everything together. But what we do have is an organization called Connects, and our job is to kind of enable some of this stuff to come through. So we build the various kind of services and centralized pieces that are required in order to make this possible. And we provide some of the SME knowledge back into the organization, but we can also play that role in trying to pull the various elements together. And I think that's happened, that's kind of working quite well for us. In particular on things like, when you're looking at global builds, like global content factories or global marketing automation teams. We develop these things called design authorities, which help to kind of bring all the various stakeholders from the different areas, brands and markets together, to try and help us kind of collaborate and work across. But it's really hard, right? And it's very slow. And it really does highlight that change management is the absolute key piece that's hard to nail. And I think if we can kind of find a way to get that right, that will help kind of push us all forward. But I think no matter your size or scale, this is the challenge that we all have, I think, in this industry.
Yeah.
Christina, if I can ask you, so the implementation of such an approach, what there's a lot of change as Julie and Amanda just talked about. Is how do you overcome some of the challenges there to driving this change through skill set planning, data, incentives? What are you doing, Gilead, or how do you see this being?
So I couldn't agree more with what Julie and Amanda were saying. I think we're so used to the one and done approach in pharma. I think we're also because we're such a regulated industry, a partnership I think is sort of implementing almost like an editorial calendar. You really have to look at what are you looking to achieve over the next 3 months, over the next 6 months in terms of your communication with the customers. And what is the content that is required for each of the channels? Like this whole idea of repurposing content and just shoving it down the different channel doesn't work. As consumers ourselves, we know that when that happens and we don't like it. So why do we think that a physician or a patient is going to like that? So I think sort of creating that content that is really customized to the channel and sort of having that planning and the foresight is really, really important. And having the partnership with our regulatory colleagues and legal colleagues who do the review of the pieces and sort of stating that sort of like that calendar and that plan ahead and the different channels that we're looking to to leverage, et cetera, I think is really, really important. And I think that feedback loop on the data in terms of, we have so many opportunities to understand what has been the reaction to the content. Amanda touched upon NPS scores. That's a wonderful way to sort of understand, do our customers like what they're seeing? Is it relevant? Is it what they're looking for? And if not, to quickly iterate and change. There's also, bounce rates, I think are a terrific tool to look at as well. If your customers are leaving you right away after they see your content, you know that something is wrong. So sort of having that way of working that is iterative, that actually looks at and reviews the impact of that content, the reaction, the engagement rates with your customers, and then really having that partnership. Again, it's not just a marketer that is developing the content to support the brand, is really, in partnership with legal and regulatory colleagues who are, walking with us in that journey.
Oh, great. Sorry, Maddie, did you try to say something or?
No, sorry, I was completely agreeing with Christina. I think the burden on regulatory and medical affairs is the other topic as well. Yes.
Yeah.
Oh, great. Thank you. So, Maddie, let me ask you, you have deep passion and experience in content strategy in and outside of our industry. So how, channel optimization obviously is still important, doesn't go away, but how do you put the content optimization before the channel? And how do you lead with content?
Yeah, good question, Mark. I think Christina really began to touch on that right there. It's really obvious to consumers, to B2B, B2C consumers, right, that when you're just taking this channel first approach and just cramming whatever you have into that, it doesn't really work. So my background comes from copywriting and also user experience design. So I try to bring some of that in. And so my take may be a little different. So I do think in terms of empathy first and iteration next after that. And that comes to play in two different ways. One, when I think optimization, I kind of think of three different things: the substance of what you're trying to convey, the semantics of, and that has a really important SEO value to it, and then the structure itself, which kind of gets to modularity and reuse, et cetera. And so I've been doing this kind of thing for long enough that I remember all the hot new things. I remembered everybody had to have a website because we have to have a website. And then it was a blog, and then it was a social presence, and then it was a native app. And none of those things guarantee success with your customers. What guarantees success is having something really important, something really relevant to say. And so I love the adoption of customer journey maps here so that we can pry ourselves away from the channel first mentality and get to this sort of the substance first mentality. And really that journey map is an empathy tool, right? As everybody talked to, it helps us understand, hey, from all the research that we have, what is our audience, what is their personality and their preferences and their interests? And then across this journey, how does the context change all of that stuff? And that's really important to sort of setting ourselves up for finding the right message for the right moment. It's also really important too, because say web is the channel that you're focused on. Google algorithms are changing all the time. And the latest ones like Penguin and Panda, they're moving away from like just keyword matching and moving into like, hey, we're going to reward you for understanding, for creating content that's relevant. And that means it's, matches intent and it matches the context. And so that really matters, getting the semantics right beyond just the keywords helps you, of course, with search and reach and relevance and authority, all those things, that we can really measure. But, you have to have something important to say that has value to your customers. And the last thing, and this is more internal for optimization, is that, creating that content in a semantic way and knowing what your message is and being able to cascade it down in value and importance is important, right? And then constructing a message that can be reused in various ways. It can be modular. It can be fit for purpose then to that platform, whatever that channel, might be. And I think that's a really good way. Then you can go and optimize that channel itself. So within all that, there's a lot of really important things. You could optimize for search, you could, optimize for message, but it all starts with that content and the meaning and the value you're trying to exchange with your customers, I think.
Well, maybe a follow-up question to that. I'm weaving some audience questions in here already because it fit. What industries do you think should pharma look at for inspiration to do this?
Yeah, so I would look at healthcare. I would look at so outside healthcare tech, finance, and technology, social technology. And here's the reason I say that, because if you look at something like industry leaders, Capital One or Fidelity Investments, or even Facebook, they understand the value of the service they provide. Fidelity understands that they are not there to just give you a managed account. They're there to help you build wealth and understand stability, long-term financial stability. Facebook isn't there to help you share cat memes. It's help you there to build like a human connection. And so they really understand the value of what they're trying to do, and how they're trying to negotiate the relationships with their customers. And so, that means, building trust. That means being authentic, means, being reliable, being truthful, and all the kind of the thread that goes through all of those is, these fundamental principles of being real human: health, wealth, human connection. Those all really matter. And some of those other industries have been really good and already using data, using their tech stacks to understand how to use that data and connect to people in a way that's beyond just like, targeting, but is real listening and trying to, build trust.
Thank you. And again, I invite the panel to comment on if you hear something from your fellow panelists that you want to add to or echo or comment on. We can continue to do this. But following this question, Christina, Maddie mentioned that understanding the customer and that feedback, incorporating it is important. What are the different ways to collect this feedback in a multi-channel engagement? Is it only surveys? Is there other ways? And then how do you dynamically incorporate that feedback into your content strategy?
Yeah, well, first, before I address the question, I just want to say I think the industry needs more of Maddie. That cross-pollination that we're seeing across industries, I think it's really coming across, and it's terrific. And sort of reflecting on Julie's comments about change management, I mean, what better? I mean, you just said it so beautifully. So I think we need more of you. Number one. But then
Maybe expect some LinkedIn posts on for job offers, okay? All of you probably.
Sorry, I'm blushing.
But to answer your question, Mark, I think one of the pieces that, we've had some success in co-creating, and it's something that we don't do enough, I think, as an industry. So co-creating with physicians, co-creating with patients. This past year, we ran a pilot where essentially we created a dummy product, put it out in the market, and got feedback from patients. And then sort of as we created the actual product that went into production, that feedback and that prioritization from the patient's point of view was, what sort of, I think, led us to be more successful. When we look at our campaigns, co-creating with physicians, and sort of put that human element and the empathy that Maddie was describing in terms of really sort of making that come across in our campaigns, but maybe using the same language, the vernacular, the pieces that I think really speak to that HCP, to that patient, et cetera, is really important. And, I would just encourage us all to really think about how do we co-create more so that we can meet the needs of, our customers, being patients, HCPs or payers.
May I ask a follow-up question? Because that's another element that I didn't speak to that I think is very familiar in product design in tech companies or in finance as well, is that co-creation aspect. Within pharma, right, we talked about how it's regulated industry, and that builds risk aversion. So to kind of link that together with like, hey, this is a very new thing, and we're introducing to a risk-averse, industry that is, very heavily regulated. Linking that back to change management, how did you get that going? How did you get that kind of co-creation activity going?
So it wasn't easy for sure. I think we sort of tend to think, we have all the answers sometimes, and that is just not the case, right? So explaining, I think, and especially, I mean, we took a conservative approach as well. We essentially said, in creating this dummy product, we're going to put it out there, right, to get the feedback, where we're going to treat it from a, regulatory legal approval perspective like a real product. So because of the number of eyeballs that we were hoping to draw, we essentially got, all of the approvals in place. And when we came back with the result, it was a lot easier, I think, for people to sort of embrace the new version of the product. They had been with us since the beginning. They were vested in sort of seeing, okay, what is the feedback from consumers here? And they had also been, they had also invested their time in making a lot of those approvals. So it was easier to sort of work on the actual final product, or, I wouldn't say final, but the iteration that went into market. And then that sort of getting through that hurdle of that first piece in terms of convincing people that it was really important to do this. And sort of putting, again, sort of turning the narrative back to a place where they could understand, what if Amazon were to call you up and say, I want to co-create a store that is designed for you. Wouldn't you be willing to do this? And sort of bringing it to terms that I think people could understand, because it impacted, a portion of their lives, what I think was helpful.
Thank you. Yeah, and do please continue to ask each other questions. That's how the panel gets most alive, and keep moving questions around as they see fit. As they fit into the dialogue here. Actually, one other question, and I put this out to all the panel members. See who wants to pick this up first, but what do you think are some of the external triggers that impact HCP proclivity behavior? And which one need to be input into content strategy? So what are some of the behaviors that are most relevant as you develop more of a content strategy? What do you want to observe? Because you have so many things you can measure and observe, right? But ultimately, do you have an idea on what you would want to look at first from a content strategy perspective?
I'll venture a short answer in that, one thing, so I come from different industries to pharma, and one thing I love, we have a lot of data. We know a lot about our customers, sometimes to the detriment of getting anything done, So I would say, what should you look at? It depends, start with the end in mind. What are you trying to achieve and what are you trying to know? To that point of building feedback loops back into it, are you trying to move some attitude or behavior? And then is there, at some point in your journey map, is there some mitigating factor? I'm sure all of us looked at how we normally thought about physician behaviors. And then once COVID came around, we threw all of that out the window and said, oh my gosh, people aren't even going into doctors' offices anymore. How is this going to change their behavior? So of course we looked at that as well. And that's really important to a lot of GSK's product line, because we have, a lot of vaccines, and that relies on people going into office. So we had to say, how is this going to change what consumers think? How is it going to change what physicians think, having, not having someone there and present in the office to have a discussion, to say, about having, some kind of wellness vaccine. So all of that changes depending on, what moment you want to look at, what behavior you want to change, or perhaps what kind of, attitude you may want to change. I would say, think about your tech stack, think about what kind of ability you have to listen to them, whether that's in forums, whether that's one-to-one creating or co-creating, as Christina said, whether that's social listening or peer reviews. Hear what they're saying. I'm willing to venture that you can find some information directly from them that talks about what their thoughts or concerns or hesitations might be.
So this reminds me actually of a comment we had in an earlier panel today about you can't just wait till the data tell you something. You need to beforehand define what your questions are so that you have responses ready. And when the data tell you the answer to the questions, then you're faster to respond rather than starting at that point. So in other words, you say the physician behavior can be different that you want to observe depending on what your objectives are and what you try to achieve: awareness, adoption, participation in activities, and those kind of things. Okay, I don't know, any other comments on the panel on this topic?
I mean, look, Matty is the expert in this space, and I think he was very eloquent in how he explained that. I mean, for me, I think the key thing is moving towards that listening, right? I think historically we've been brilliant at push content. We're it's like, I want to say this. So we're like, I want to say this and I want to say it now and you got to listen to me, right? Whereas, HCPs are people too, right? They like their content in multiple different places and multiple different ways, and probably no 2 or 3 of them are the same, right? So I think we got to move away from this idea that we can be brilliant at our targeting with our messaging, and find ways to be able to really listen and understand what's landing. And that's not easy. It's not easy for us as an industry to be able to, understand all the different data feeds and be able to pull them all from the different places and kind of make something sensible out of that. So in the meantime, until we get to that space, there is a huge place for kind of looking at social listening and even just, interviewing and going, asking people and seeing what's kind of landing and what's not landing. So, I mean, that's very short, but that's kind of what I'd be thinking in that space.
Yeah, I agree, Julie. I think, social listening is something that I think it's a tremendous tool and so cost effective as well. And understanding that, patient voice, physician voice, and this year we were looking at, patients that had, Crohn's disease by way of an example, and just really understanding even some of the body arts. And I think what we learned from looking at, there was a trend of, so many patients getting tattoos to remind themselves of their disease and the struggle, and just sort of looking at the art and sort of really understanding, what insights we could gain from that was incredibly eye-opening to us. And there's a tool that allows you to do that in a very cost-effective way. So I think that is something that, I look forward to incorporating more and more in the next year.
Maybe one last point to make is, use the tools that you have. We talked about change management and we talked about ownership of different parts of this. So, it doesn't have to be so sophisticated. I'm often really amazed when we get multi-channel marketers together with people from the field, sales people from the field who can still take that, that traditional relationship, rep-driven relationship building, all of the perceptions and, observations that they have and bring them back in and fold that in. And, that's always a really, really great way to continue to bring information back in and, help fuel more insights.
Oh, great. So these insights, another audience question I want to weave in here is, if you work in a global environment, how do you bring the local market feedback and help to inform the global content strategy? Because in most organizations, a lot of the messaging and content strategy is still cascading from global to regional to local. How do you bring those local insights into the global environment? Do you have any thoughts or experience there?
Yeah, if I could start on that one. I think Gilead is probably a younger organization compared to, my peers on the panel. And we didn't have a really, formed global marketing organization until recently. And one of the things we've actually rolled out is this whole concept of global with local, so that, we can have that voice of the countries in the co-creation, in the strategy building, et cetera. So I think that is really important, and something that comes out of global should probably address, 80%, and then give the countries the ability to, refine and localize. But I think co-creation, again, countries with the global team is really, really important.
Yeah, I would agree with Christine. I think, first of all, I mean, in my case, once we set priorities and campaigns, the fewer the better, but they need to be agreed through an interlock process between the regions and the global. I think that was something else that I witnessed when I joined the organization, that I had really two separate marketing organizations going in different directions and not working together. So I think the importance of interlocking, not just the beginning of the year when you're setting your plans, but also throughout the years, as well as throughout the campaigns. The second piece, and I think we mentioned that earlier, and again, I go back to that point, it's accountability. Who owns the customer? It's not a global marketing organization. I expect the regional marketing organization with the regional sales to own the account and the insights that comes from the field needs to be brought back to the global organization. So that's another reason why I think that there needs to be a clear communication, open communication channel on both directions between global and regional marketing.
Amanda, do you do this via workshops? Are there any tools? How do you bring that? What are some of the practical tools or approaches that you use?
It used to be the dates defined in our calendars for face-to-face workshops where we would go through either therapeutic areas or product lines with the entire regional and global marketing teams, but also inviting sales and product leaders. They transformed into very long hours on Teams, but I think we're trying to make maybe squeeze a little bit the topic so that by the time that there is a lot of offline discussions that the teams are having. So when we need to make decisions, a lot of the first level, second level, again, interlock, it's already happened. But yes, that I don't have any in softer, sophisticated ways in which we're doing that besides spending hours on together and defining also KPIs. And I think that's the other aspect which I think is critical, because the biggest part of the discussion over the years has been, in the same way as we might have a lot of data, we also have a lot of activities, and activities for activities, don't mean much. So trying to shift, looking at the outcome of those campaigns and the impact that it brings to the organization, it really what triggers the decision whether we should pivot or continue on a specific campaign. And again, the feedback can only come from the field. So I think it's important to review those, and we try to review those on a quarterly basis.
Very good. Actually, here's a question that I personally like very much. How do you leverage third-party and user-generated content as part of your personalization strategy? Any thoughts? I have some thoughts around that, but you guys are actually doing it, so. Any takers?
Like, I could tell you, for one, there's a lot of people nervous about third-party cookies, especially, so the idea of that going away is a source of constant conversation, and it does get back to how do we leverage more one-to-one information and insights? How do we build relationships? And so I know that's something that we're really working on. We are far from solving it just now. So, I know I could just chime in and say, I don't have the answer, but I have a lot of questions about what we're going to do. But there's, I am curious to hear other insights about user-generated responses.
So the way that we are, maybe I can put this out there at Indegene, looking to support our clients with services that take third-party and user-generated content, analyze it first of all, determine what is supporting your brand message, what is contradicting your brand message, and what is plain misinformation out there, which is a major issue in that domain, right? When you think about third-party and user-generated, not all third parties are reputable. And basically to use that as curated and use it as input sources to develop your own content strategy, amplify credible third-party content that supports your messaging, focus on content that combats misinformation in cases where that's prevalent. And thirdly, then also look at messaging that will counteract or neutralize some of the messaging that's not plain false, but it's maybe not supporting you in your brand messaging. And that's a very different way from how an agency typically works on creating just original content themselves, by basically leveraging third-party and user-generated content as a basis for additional content to supplement what you're building on your own, and then get it out through multiple channels. So that's, if I can add that into the conversation. But that's why I like that question so much.
Yeah, it gives you a nice opportunity for a nice plug.
we normally don't do, but I'm too passionate.
No, I have to say, like, it is a really interesting space, and it's an area that we talk about, but I would say that we're not quite we have some foundational stuff we need to get ready first before we can begin to really embrace that element yet, if I'm being honest, right, in terms of where we're at. But it is definitely something that we need to be considering as we move forward. I just don't think we've other stuff that we need to kind of focus on first.
Yeah. Amanda, now as you continue with your transformation, what are the next big questions or roadblocks that you're tackling? You know, maybe it's data, maybe it's insights. How are you approaching those things? So which are they, and how are you planning to approach that?
Yes, I mean, certainly the biggest obstacle is getting access, and you mentioned it, to data and insights. I think is getting access to user behaviors and individuals and functional preferences in real time. And I highlight that in real time, because certainly that's not the case for us. And maybe just a quick parenthesis. You know, I wish the insights I need are not so much from HCPs, but I need them from the people that are on the panel today, because those are our customers.
Ask away.
So you don't have access to a lot of data, as you can imagine, because certainly, you know, there is a desire not to share so much, but that is the additional complexity. But I think that's the key for us is to, of course, we understand preferences, and it goes back again into you know, the depth of the relationship with the different stakeholders. But being able to realize those changes in real time and being able to internally react fast, I think is the critical pain point that we have. And as well as understanding, you know, getting the data to really understand if the campaign is working correctly. Are we getting tractions? Do we see interest from pharma? Do we see, you know, new opportunities or new leads and, you know, generating? And how do we manage the funnel in real time? So the journey for us is really just starting and just rolling. So you heard me, I was quiet on a couple of the questions because I'm actually taking notes, right, rather than contributing. But as the journey is rolling, I think we're also adding a lot of complexity. So, you know, you asked me how I'm tackling some of the roadblocks. I think one of the pieces for me is that I want to avoid building too much complexities in terms of how many buying journeys, how many customer segments, how many different personas. Not so much for the marketers, that I think, you know, that's the language they speak, but for the sales organization, that you know, the more complex we make it, the more difficult it is for us to drive that change. So I went to, you know, we went to a point of the journey where we realized that we were creating too many layers for the sales organization to deal with. And also, I think, you know, as content is getting, the other aspect here, as content is getting more sophisticated, it also requires a higher degree of knowledge from the sales organization, from the regional marketing organization, to be able to fully understand the material and to be able to fully understand the requirements, the needs of the different stakeholders that we speak with within pharma. So those are the areas that worries me the most. So for me, the big question is, how can we continue to grow and advance, maintaining internally an organization that is as agile as possible, so don't putting so much burden on marketers as well as sales. Is there an opportunity for us to externalize more of the work that we're doing? The first, you know, I'm tackling heavily improving the ability to improve our end-to-end IT and, you know, sales and marketing tech stack, because that is the fundamental source of my data and my insights, and to simplify some of the key internal processes as much as we can on the approval processes, for example, and having those KPIs very clearly in front of us so that we can pivot if we need to pivot. You know, I've taken here two opportunities today from this panel. One, which is, if there was any opportunity for us to co-create with pharma, that would be the biggest, the biggest, improvement. I think really a way to tackle it. And I will take it offline with Christina, with Julie, for sure, and with Maddie. And at the same time, I think social listening is also important for us. We don't know yet how, but it's one of my priorities of this year. And again, it's not only social listening from a HCP standpoint, but it's much more, understanding the macro trends and how each pharma company is reacting, but even within pharma, how each department is reacting. What is their strategy? Do we understand it clearly? I think that there are ways in which we can also benefit from social listening. So
great.
Thank you for those two hits.
Well, actually, if we're wrapping up, but could each of the other three panel members just give us a 30-second, 40-second recommendation for the audience before we wrap up on what they should tackle next? What's the next big thing to tackle as you move toward a better content strategy?
Oh, I think the big thing for me is like, we said it a few times, but it's the change management. It's get the mindset right across the organization, and it's putting the time, effort, and thinking process into doing that correctly and putting the weight behind it. That'd be the big one for me. I think everything else, we got the expertise and people understand it. It's just trying to help make it work in the organizations, the hard bit.
Thank you.
Yeah, for me, it's the partnerships. I think whether it's, that partnership internally with the marketers to really think about, more of an editorial calendar, more planning around the different channels, partnerships with legal, regulatory, medical affairs, partnerships with our customers in that co-creation process. That is the key for me.
Great, thank you, Maddie.
Yeah, I would say embrace these tools that we have, like personas or subsegments and customer journey maps. Like embrace those to kind of not as a means or an ends to themselves, but like a means for sparking more curiosity and questions. Try to be the outsider. Try to get in and think like, what is it like for this person? What are the assumptions and beliefs that they have that you don't have? And see if you can try to embrace that and use that kind of new frame of reference to sort of challenge the status quo and see new possibilities in the way that you connect with your customers.
Fantastic.
Mark, if I can add, I would say embrace it and be persistent, because this journey doesn't happen overnight. Mm-hmm. And there are a lot of different right? A lot of different internal functions that need, it's a long-term process, and I can see some fatigue taking place, when that change really doesn't happen overnight. But I think being persistent, because that's the only way to go anyway.
Fantastic. There's so many more audience questions. I recommend the audience to use the networking tool on the platform to connect and ask could have some specific questions to Maddie, to Amanda, to Christina, to Julie. So please reach out, connect. There's only industry colleagues here. There's no vendors here, so don't worry about solicitation. Connect, talk, inspire each other, and it's really a great panel. We're very privileged being able to have that discussion with you today. And be well, enjoy the rest of the conference. I look forward to continue this dialogue. It's certainly going to be a key shift in the industry that we're going to witness over the next few months and years. Thank you.